What if the secret to better health was sitting quietly in your kitchen pantry? Not a miracle pill, not an exotic herb from across the globe, but a humble white powder you've likely used to bake cookies or freshen your fridge. Baking soda, yes. The same sodium bicarbonate you use to fluff up your muffins has been quietly doubling as one of the most underestimated natural remedies in modern wellness. For generations, this everyday ingredient has played a supporting role in households. But today, it's time to pull back the curtain and explore baking soda as a central player in promoting human health, especially for older adults seeking gentle, low-cost alternatives to pharmaceutical interventions. From soothing heartburn to improving kidney function, the science-backed and anecdotal uses of baking soda are as surprising as they are practical. This guide dives deep into the therapeutic potential of baking soda, uniting medical insight with real-world applications to help you harness this powerful home ally safely and effectively. Digestive health and heartburn relief. Baking soda, or sodium bicarbonate, is widely recognized for its ability to neutralize stomach acid, providing quick and effective relief from heartburn and indigestion. Its alkaline nature allows it to counteract the hydrochloric acid produced in the stomach, thereby easing discomfort caused by acid reflux. A traditional remedy involves mixing half a teaspoon of baking soda in a glass of water and sipping it slowly. This solution acts as a natural antacid, calming the burning sensation in the chest and throat. While it is an accessible and inexpensive remedy, moderation is key. Overuse can disrupt the body's acid-base balance, leading to a condition called metabolic alkalosis, characterized by symptoms like nausea, muscle twitching, hand tremors, and confusion. Individuals with hypertension or those on a low-sodium diet should be particularly cautious, as baking soda contains sodium. In clinical settings, sodium bicarbonate is occasionally used to treat acidosis and as a buffer in certain medical emergencies. However, self-medication without medical supervision, especially on a regular basis, is not advisable. Instead, occasional use for mild, sporadic symptoms are generally considered safe for healthy individuals. Oral health and teeth whitening. Baking soda is a common ingredient in many toothpastes due to its gentle abrasiveness and natural whitening capabilities. It helps remove surface stains caused by food, beverages, or smoking. Additionally, its alkaline property neutralizes acids in the mouth, which helps prevent tooth decay and gum disease. Brushing with baking soda can also reduce plaque buildup and freshen breath by eliminating bacteria that thrive in acidic environments. However, because it is mildly abrasive, excessive use can wear down tooth enamel over time. Dentists recommend using baking soda-based toothpaste no more than 2 to 3 times a week, and always with a soft bristled toothbrush. For those with sensitive gums or enamel, it's best to consult a dental professional before incorporating baking soda into your oral hygiene routine. A safe DIY option involves combining baking soda with a small amount of water to form a paste for occasional use. Always rinse thoroughly after brushing and follow up with a fluoride toothpaste to strengthen enamel. Skin care and itch relief. Baking soda has been used in skincare for generations, particularly for its soothing effects on irritated skin. Its anti-inflammatory and antiseptic properties can offer relief from minor rashes, insect bites, and sunburns. To make a calming bath, add a quarter cup of baking soda to a lukewarm tub and soak for up to 40 minutes. This can help relieve itching and reduce redness, especially in conditions such as eczema or contact dermatitis. For localized itching, a paste made from baking soda and water can be applied directly to the affected area for 10 to 15 minutes before rinsing off. While generally safe, individuals with sensitive skin or allergies should conduct a patch test before broader use. Baking soda may disrupt the skin's natural pH balance if used excessively, potentially causing dryness or irritation. Antifungal properties. Baking soda demonstrates potent antifungal properties, making it a natural remedy for conditions like athlete's foot, ringworm, and candidiasis. Fungi typically thrive in acidic, moist environments. Baking soda's alkalinity alters this environment, weakening fungal cell walls and inhibiting their growth. Studies have shown that a 10% sodium bicarbonate solution can inhibit the growth of certain fungal strains. A practical application involves mixing baking soda with water to form a paste or adding it to foot soaks. Applied regularly, it can help alleviate symptoms and speed up recovery. Despite its effectiveness, it's important to note that baking soda is not a substitute for antifungal medications in severe cases. If symptoms persist or worsen, professional medical treatment is necessary. Urinary tract infections, UTIs. Some natural health advocates suggest using baking soda to relieve the discomfort associated with urinary tract infections by neutralizing the acidity of urine. This may, in theory, create a less hospitable environment for bacteria. A commonly recommended approach is to dissolve half a teaspoon of baking soda in a glass of water and drink it on an empty stomach once a day. While anecdotal evidence supports this method, scientific validation is limited, and misuse can lead to health complications. UTIs require prompt and appropriate treatment, usually antibiotics prescribed by a doctor. Baking soda should not be considered a cure, but potentially a supportive measure for mild symptoms in consultation with a healthcare provider. Canker sore relief. Canker sores are small, painful ulcers inside the mouth that can make eating and talking uncomfortably. Baking soda, with its anti-inflammatory and pH balancing effects, can help reduce irritation and promote healing. A mouth rinse made with half a teaspoon of baking soda in a glass of warm water can be used twice daily to soothe pain and prevent infection. It's a gentle, affordable remedy for most cases. However, persistent or large sores should be evaluated by a dentist or physician. Athletic performance enhancement. In sports science, sodium bicarbonate is known for its buffering capabilities, particularly during high-intensity exercise. As muscles produce lactic acid during strenuous activity, a buildup leads to fatigue and soreness. Baking soda helps neutralize this acid, potentially extending endurance and improving performance. Athletes sometimes take small doses, typically 0.3 grams per kilogram of body weight, about an hour before exercise. However, side effects such as nausea and bloating are common, especially without professional guidance. Due to these risks, it's best to consult a sports nutritionist or medical professional before integrating baking soda into a training regimen. The benefits can be significant for some athletes, especially in sports requiring bursts of intense effort. Kidney function support. Chronic kidney disease, CKD, often leads to metabolic acidosis, a condition where the body accumulates too much acid. Baking soda as a bicarbonate source can help neutralize this acid, easing the burden on the kidneys. Clinical studies have indicated that sodium bicarbonate supplementation can slow the progression of CKD in some patients. Improved bicarbonate levels are associated with better kidney function and overall health outcomes. However, self-treatment without medical oversight can be dangerous. Sodium intake must be carefully monitored, particularly in patients already at risk for hypertension or fluid retention. Arthritis and inflammation. Baking soda's influence on systemic inflammation is a developing area of interest in immunology. Preliminary research suggests that sodium bicarbonate may encourage the spleen to produce anti-inflammatory immune responses. In one study, participants who drank a baking soda solution daily showed decreased markers of inflammation associated with autoimmune conditions such as rheumatoid arthritis. While promising, these findings are not yet conclusive. Anyone considering this approach should first discuss it with a rheumatologist. It's a complementary strategy at best, not a replacement for conventional anti-inflammatory treatments. Gout symptom management. Gout results from an accumulation of uric acid in the joints, leading to intense pain and swelling. Since baking soda can raise the pH of body fluids, it may help dissolve uric acid crystals and reduce flare-ups. Anecdotal reports support this usage, but like with other applications, moderation and medical supervision are crucial. Overuse may lead to increased sodium levels and associated complications. Cold and flu symptom relief. Baking soda can be a helpful ally during cold and flu season. Gargling with a baking soda solution can relieve a sore throat and reduce bacterial load in the mouth. It can also assist in loosening mucus when used in a steam inhalation or saline rinse. While it won't cure viral infections, it can make symptoms more manageable. It is particularly effective when combined with other natural remedies like saltwater rinses and hydration. Cancer therapy support. Some researchers are exploring the use of baking soda to alter the tumor microenvironment. Tumors often create acidic conditions that promote growth and resist treatment. Alkalizing these areas might enhance the effectiveness of chemotherapy. In animal studies, sodium bicarbonate appeared to slow metastasis and improve drug delivery. However, this field is still under investigation, and no human treatments involving baking soda are currently approved. Cancer patients should never attempt self-treatment and should only explore these strategies under close medical supervision as part of a broader treatment plan. Natural deodorant alternative. Baking soda's odor-neutralizing properties make it a favorite in natural deodorant formulations. It absorbs sweat and reduces the activity of odor-causing bacteria. A DIY deodorant can be made by mixing baking soda with coconut oil and essential oils. However, some people experience irritation or rashes from frequent use, especially on sensitive skin. It's recommended to start with a small application and observe for any adverse reactions. Alternatives like arrowroot powder or magnesium hydroxide may be better suited for those with sensitivity. Precautions and considerations. Despite its many benefits, baking soda is not without risks. Dosage. High intake can lead to metabolic alkalosis, electrolyte imbalance, and increased blood pressure. Medical conditions. People with kidney, liver, or heart disease should consult their physician before using baking soda therapeutically. Medication interactions. Baking soda may reduce the absorption or effectiveness of certain drugs. Skin sensitivity. Topical use can cause dryness or rashes in sensitive individuals. Always patch test first. Used responsibly and in moderation, baking soda can be a valuable addition to natural health practices. But as with any remedy, it's essential to consider your individual health context and seek professional guidance when needed. In a world overflowing with complex health solutions, it's refreshing to rediscover the profound impact of something so simple. Baking soda is more than a kitchen staple, it's a quiet hero in the wellness toolbox, offering relief, prevention, and even performance enhancement for those who know how to use it wisely. Particularly for seniors seeking trusted natural remedies, baking soda presents an accessible path to better health. But like any powerful tool, it must be handled with care. Its benefits are real, but so are the risks of overuse or misuse. Armed with knowledge and guided by common sense and your doctor, you can make thoughtful choices about integrating baking soda into your daily routine. Let this be a reminder. Sometimes the most powerful solutions don't come from laboratories, they come from your kitchen. Disclaimer: this content is intended for informational purposes only and should not be considered medical advice. Always consult a qualified healthcare provider before beginning any new health treatment or supplement, especially if you have pre-existing conditions or are taking medication.